Breakout rooms. Add. 1, 2, 3, 5, 6, 7. Okay, and then I'll figure it out. Hmm. Okay. Okay. Why isn't that okay? I am going to set a timer because I always like overshoot. Okay. Um, there. Okay. I'm going off camera for just a second. Everything is set up, and there is no sound. Oops. Oh, that's a docx. Not what I wanted. I wanted. Copy that one. That's what I want. Okay. Oh, you know what? Oh, okay. Here I am goofing off.
Hey, I'm just trying to eat.
Oh,
I'm
you're
sorry.
fine. You're fine.
Starving.
I don't have an issue with you, but I'm just gonna state camera has to be on if we are interacting with one another. Even if you're not speaking, okay? Just so we're on the same page on that.
I thought I had it on. I walked out of the room for a
I
minute.
you're 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 usually awesome, okay? I'm not like I stated, there's others
Yeah,
that turn off the camera every so often.
yeah, you gave me some more research to do.
We got to make sure it's you, especially especially for today because it's a proctored exam.
It,
Yeah.
man,
So we're gonna have a quick lecture, and then I'm going to break you guys off into separate rooms. What I'm gonna need for you guys is obviously your name, which I know, but also your student ID number and the state that you live in, so that I can put that down for my records.
my food time, you know, I don't remember it.
I know paperwork.
Yeah.
So,
Hmm. Let's see, I can wait a minute. Let's get more screen for a minute.
and we'll be going over what is expected for that as well when everybody else gets in.
Can you
I'm
see
not
if
gonna
I
like.
can find my ID number real quick?
I hopefully you understand. I don't just let people loose and make you guys figure it out yourself.
I hope not.
No, that's not how we work.
That
So,
is, I can make that.
hmm Still checking to see if anyone else shows up.
Well, I'm still. Oh, what can I
I,
do?
do you feel comfortable with materials so far? Do you have any questions?
No, I feel great. I've been doing pretty good on it so far, I think.
Yeah.
I think.
Yeah, no, I think you have as well. I always like to ask people because some people like stay quiet because they don't feel like they should ask questions. And I always am like, ask them, please.
Yes, I've been doing pretty good with it by myself. So,
Okay. All right. No, that's
uh,
fine too.
except when you surprised me with those extra questions for discussion.
Yeah. No, I
Oh,
get
wait a
it.
minute, wait a minute, wait a minute.
Yeah.
It had to be after every outdoor.
Yeah. No, see, the thing is I hate hearing my own voice, and I'm sure that my voice is like a drone by the end of the lecture. And I always worry. So,
I haven't found it yet, so yeah, I haven't found it yet, so I'm looking.
okay.
Oh, maybe I'm getting to my account with my phone. Where is my phone? I just got off. I grabbed something to eat. So,
See, I can go like this, and I can put you in that one. Cool. When we are ready, I can put you in that because you're in here. I was try I'm trying to figure out the little particulars of Zoom, and because I'm familiar with it, but I'm not completely, you know.
yeah,
So
I not either. I mean, I'm old school here.
yeah, no, same. But I over the years have started to master all the different little web conferencing items, which is helpful.
I know with all these discussions and certain writing, huh? I
Yeah.
figured it out. I had to go.
Yeah. And like I said, the first week I was generous. But as the weeks go on, I am going to be a little bit more to the rubric. But I think you were fine last week as well. I don't think there was an issue. Um, no.
You're trying to find
Yeah, you're doing
my
great.
number. I never had to have used it before.
Oh. Okay. Why is people late? All right, I'm just gonna wait 5 more minutes for everybody, and if they don't show up, we'll just get started.
I guess I mean you.
Yeah, because I mean, you respected my time, I'm gonna respect yours. But this time around, it's like that pre in class assignment doesn't really count for, well, they really doesn't count for any of the lectures, class meetings, but it obviously needs to be done. Um, but this one in particular is worth 100 points. So, because it's a proctored assignment.
Mm.
Yeah. You're gonna do great. Relax. And if by chance, there are some areas that you're not sure of, we will always go over it as well. We're gonna review it after next week, not this week, but next week. So, but you have health in background.
Yeah,
Okay, so
and I'm working in a warehouse, pharmacy warehouse right now.
oh well, there you go. Then you're probably familiar with a lot of this terminology that we're gonna be.
Yeah, he told me that as soon as I get my nationals or techniques, they're going to train me over in the pharmacy side of it.
Oh, good.
Doing that.
Yeah,
It was
and
damn,
depending.
it was a bad day today. One of
Oh,
our sort line was stopped on us. We had medications and already packaged piled up everywhere
uh,
because the sort line stopped. So I'm working in shipping as a clerk right now. And
yeah.
oh my God, let me go home, please. Thank God I'll leave at 6 o'clock today.
Yeah, and you're going to have to think on your feet and move swiftly to try to correct whatever is going wrong. And you are getting that hang of it right now, so that you're going to be fine once you hit the pharmacy.
When is that video due? Next week?
The video, yeah. So next week is actually a lab because there's no lab due this week. You got a little bit of a breather.
Okay.
It is
Well, I ain't gonna
measurement.
be home this week.
So next week's class is really important to be at because we are going to go through the math portion together.
Okay, good.
I'm going to show
Well,
you.
I did good on my dosage and math. I made an A in it last
Right.
semester.
Well, I just want to make sure everybody is on the same map and knowing how to do the math. That's just how I operate. And we will go through the whole lab, but the experiment portion, when you do go do the experiment, you will need to videotape yourself. That's very important.
That's what gets me the video.
And
I get nervous.
and
I
whatever
get
you did last week, Andrea, you were fine.
nervous.
So
I
just
was dropping stuff. I was dropping oil. I'm like, wait a minute.
I know.
I paused it. I said, let me step away real quick.
Yeah, I smiled when I saw your message. I'm like, I am sure she did everything right. Let me just go check though.
Oh, I
Okay.
don't have my number anywhere.
Mm-hmm.
Ooh.
Let's see. Did anyone else? Oh, Jasmine is here and Anna's here. Now, see, I'm thinking we're alone. Jasmine. All right, ladies. So I have to make clear if you received a message from me today, not everybody did, but you are missing something out of your grade book. I do need that done ASAP as soon as possible, okay? Um, and thank you for that nod. The other thing I want to state is that today's proctored assignment is worth 100 points. And we will go over that in just a moment. And next week is very important. If you, oh, I do know Jasmine did it. Jasmine, I need that measurement system video, okay? Um, that is going to be the lab we're going to go over, and we're going to go over the math as well, within that lab. But it's very, oh, you sent in the inventory management. There was actually two lab videos I was missing. You sent in one, but not the other one. So it's the lab video upload two, which would be in week 4. Okay. There's a link. And I will get that posted in week 4's announcement out, but you still have time to get that video in. Um, I just need to have those labs submitted. The other thing I wanted to state is that I'm going to be putting you into breakout rooms when we do get to the proctored assignment. Um, you need to have your camera on all times. You need to have your student ID, and you also need to
And
give
that's
me
what
this.
I counted.
Yep. And you need to also provide me the state that you live in. Okay. And this is just for documentation purposes because I need to send it into my program chair, Dr. Aboiji, for verification. And I will be popping into the breakout rooms to make sure you're still on camera. And I will provide you with a screen share, actually, probably the document as well,
Okay,
that you'll do. You'll be
not
able,
fine his ID.
yeah, you'll be able to type in a box of what your answers are. So I always say, because you probably will not be able to edit the PDF, you're going to want to have a Word doc up so you have that so you can save it to a Word doc and then copy and paste it into that text box, okay? Does that make sense? And Martha's here
We're
too.
doing
Great.
what?
Does that make sense? So you're going to have a PDF that I'm going to give you access to a PDF. You're going to type in your answers in either the text box or the Word document. So that you can then copy and paste it into that text box, or you can just type it in the text box if you wanted to, um, because that's how you're going to submit that, and that assignment is going to be worth 100 points. So I have you assigned to different breakout rooms when I do open them up. You will be immediately not immediately, but you'll be taken over to your breakout room, and I'll be popping in to make sure that everything is going okay. You're on camera. And I will answer general questions if you need. Okay. But first, we're going to go over chapter 5 because we've done the routes of drug administration and I don't even remember dosage formulations. I apologize. I don't even remember what the title is. Our learning objectives for this week was to differentiate between the terms of route of administration, dosage form, and drug delivery system. You were to identify different inactive and inert ingredients in various tablet coatings and their functions, and explain the advantages and disadvantages of the varying routes of administration. Pretty much just the first one and the last one. Okay, that was really expected. So the first section here is routes of administration. You either have the drug getting into or onto the body, either in a systemic effect or a localized effect. And your routes are oral, which is usually in tablets, capsules, syrups, and suspensions. That is the most common and the most people will encounter at some point in their life. Then transmucosal, which is lounges, sprays, troche tablets, which are dissolving, and I always call it, that it's not Pepsid AC. For some reason, I'm thinking Pepsid though. It's that little tablet that like fizzles and does stuff. Effervescent tablets. And then you have the topical transdermal, and you have that. Those are your creams, your ointments, pastes, patches, and plasters. The next set that we came across was inhalation and intrarespiratory, which is your dry powder inhalers, metered dose inhalers, or nebulizer solutions. Most of the time, that's either asthma related or COPD, which is chronic obstructive pulmonary disorder. Then you have the parental slash injection. Injection shots, injectable pen solutions, and IV solutions. Now, this you do need to be careful because a lot of times people get this confused with another form, and that is subcutaneous. Because a lot of the injectable pen solutions could possibly be related to diabetes. Okay, and that is not necessarily in this category. It is usually subcutaneous. This is typically something in the hospital. You might be getting, if you have MS, you might be getting an injection, you might be getting an infusion. Um, Also, uh, you might be getting like antibiotics through IV. So that, those kind of things, or maybe it's a morphine drip for pain. Rectal and vaginal, ring suppositories and solutions. And keep Okay, yes, you can show me your ID, Martha. I just noticed it. Okay, and um, I apologize. I did not see the message until now. The
It's
Yeah,
okay. Thank you.
not a problem. And yeah, I can work with that as long as it's done by 10 o'clock. Are you in Central or Eastern?
I'm in Central.
Okay, so 10 o'clock your time?
Yes.
Thank you. I
Thank you so
apologize.
much.
Not a problem. The reason why I'm asking is because I'm in Eastern, so
Hmm.
I need to know.
Okay, that makes sense.
Yeah. Okay. I
Thank you.
Not a problem. I appreciate you informing me. Implants are like pumps, radiation seeds, stents, and wound dressing. So that's like, you got chemotherapy is a good one for that. It's gonna be a pump. It's pumping it in. Ocrevus, which is a medication for MS, is also like a pump. It's infusioned in. So that also would fall under there. Topical dermal, creams, lotions, ointments, powders, and solutions. And then inhalation. Did we just go through? Didn't we just, did it have it before too? Yes, it did. Dry powder inhalers, meter dose, inhalers, nebulizer solutions. for inhalation, transmucosal spray solutions, and suspensions. They give a little bit more here for vaginal and rectal, suppositories, solutions, creams, gels, and ointments. Those are not fun when you have to write out a prescription sig for, which is what we will be going over in a moment. I am going to skip over the active versus the inactive drug ingredients. This is good to know. You're going to need to know. And we'll probably be coming back to it. It's more as in um, the pharmacology portion of the information that we'll be providing. It is very good to know, though, if you want to make like a flashcard and with the ingredient, the use, and maybe an example also on the side with the use, I would highly suggest that because some of these will be on that certification exam. I do not know. Have not looked at the final exam to see if it would be on there, but I will look at the final exam to see if I can give you some hints and tips. Um, then we have the oral routes of administration. Like I said, this is the most common that you'll find. You're going to have, it's going to go straight into the gastrointestinal tract. Okay. That is where it goes. You put the pill in or the capsule in, you swallow it. It is slower to get into your system. Typically, they say it takes between maybe 7 to 14 days for that medication to be at full effect. So that's why they say it's very important that you take the medication daily, on schedule, and don't miss a dose. Then a topical application and metabolizing. Topical application, depending on what it's for, it's going to go into the skin, it's going to go into the system. It's a little bit, I'd say, quicker, but not so much as quick. It's still going to take some time for it to start doing what it needs to do. Okay, so the tablet's easier and less costly to produce. Very important these days. We're always trying to save money. Insurance companies are trying to save money. Sugar coated and film coated. They can be chewable to treat flatulence, or that otherwise known as gas. And compression tablets. I have really bad GERD, which is heartburn, pretty much, right? I'm pretty much at least every day taking 2 or 3 Pepsid Cs, which is in chewable tablets, and I chew it to get it into my system. And I really need to get checked out again because that's not right. Transmucosal routes of administration. You have a sublingual route under the tongue. Buccal route, that's in the cheek. Ocular route, which is in, I believe, the eye. Yes, eye or ear. I don't remember. I have not dealt with ocular for a while, so anyone knows it, they get an extra point for me.
I'm thinking it's the eye.
Yeah, I think it's eye as well, but I am just gonna double check that because I don't like giving bad information. Ocular, yeah, it's eye because ocular migraine, which is connected with the eyes or vision. Okay. Sorry. You not going to remember, like I was trying to say before, you're not going to remember everything, okay? So you're going to have times when you have like a disconnect with the word. You're going to have to look it up or ask somebody. Okay, so then we have the otic route, which is the ear. Let's see if I would have just gone to the next one, I would have known. Intranasal, through the nose. That's your nose sprays. Ear drops for ear infections, eye drops usually for dry eyes. That's the main reason why it is prescribed. The next route is topical. Dermal or transdermal. So you're either doing on the skin or within the skin. Inhalation routes of administration. Aerosols and metered dose inhalers. Like I stated, and inhalation solutions and nebulizers, typically for asthma. COPD is another one. There's probably a few other that I'm not thinking of. but they're going to help somebody who's having difficulty breathing or experiencing shortness of breath. That's 20, so 21. All right, so this is the one I really wanted to go over, the parenteral routes of administration, because it's not common. You're going to see it in a normal retail pharmacy. This is going to be more like in a hospital or clinic pharmacy that you're going to see it, or possibly maybe if the doctor's office has a pharmacy on site. And some doctor's offices do. Yes, it is mentioned here. I'm sorry, I went too fast. Subcutaneous under the skin is mentioned as one of the forms. But we got to be careful with it, like I stated, because some insulin medications are self-medicated and don't necessarily fall under what, when I think of this particular form of administration. Okay. But it's not incorrect. So I know one student did mention that, and it's not incorrect, but in my mind, it flagged it. Intramuscular into a muscle, and an IV. I think that's the one right there, right? IVs. Why isn't this letting me? Let me go, make this smaller for a second. It's not. I just want to make sure that, yeah, IV's the last one, into a vein. So that's typically in a hospital, or a doctor's office. So the intramuscular might be Prolia, which is for osteoporosis. As a female, you need to be aware that as you get older, sometimes your bones get a little brittle. Um, then we have drug delivery systems. You are going to come across a lot of abbreviations. You got controlled delivery, CD. CR is controlled release. Delayed release is DR. Long acting, LA. Sustained release is SR. Timed release is TR. Extended length of release is XL. And extended time release is XT. Some medications will have one of these abbreviations under it, and then they'll have something else that doesn't have same medication, but it doesn't have an abbreviation. So you need to be really aware and paying attention to a prescription if it has something next to the medication name, because it's going to tell you exactly what medication the doctor wanted the patient to have. Other drug delivery systems include the solutions, the suspensions, emulsions, and colloids. Now, we all know that typically a lot of your solutions and suspensions is for people who are either very young in age, or they're older, or they have a health condition that prevents them from swallowing correctly or swallowing anything really too much. So that is the end of the lecture, okay? I am going to stop sharing this. What I'm going to do, because I'm double checking to see no one else popped in. Okay. Oh, perfect. Thank you. I just, what I, let me just, all right. Uh, do you have your student ID, Martha? The number, the student ID number? Okay, so I am going to pull up the document for you guys. I'm going to also share it in your breakout room. What we are going to do first, I want to go over a little bit of it so that you. Oh, wait a second. I have to. Is that it? Please be it. Yes, it is. This one right here. Okay. So, hold on. I'm coming back. That is. So she's South Carolina. Okay. And I apologize if I'm muttering. I'm just getting okay, hold on. I am going to get this document pulled up, and then I'm going to have you guys go into your breakout rooms. I already have you assigned to them. I will just flip it over. The one thing I do ask once I do flip you over to your breakout rooms, your camera does need to be on. I need to be able to see you when I pop in. And I do need to either have you tell me in the message, yeah. Hold on a second. You guys are all full of questions today. That's fine. I like questions. Okay. So, Jasmine, you said did you send your ID to me, or all you have to do is tell me what your state is and your student ID is, and then that's good for my documentation purposes.
Okay, I was just making sure.
I don't necessarily need, but I do need the student ID and I need the state. So that you can give to me in the breakout rooms when I put you guys there. Because I understand some people don't want to share like maybe the student ID. But here
I
is,
don't I don't
oh, go ahead.
I don't have my student ID. I never got a student ID. I might have the number on my written down, but I have to look for it real quick.
Okay, that's fine. You'll have time.
Thank you.
You're welcome. This is what the assignment is going to look like. You are going to be given 10 different prescriptions that you are going to need to write. Okay. Let's put it right here. Oh, that's why. Okay. You're gonna have to write it out, and you're gonna have to write out. Try your best. I understand that sometimes it's hard to read doctors' language, but you're gonna want to write out the medication, the strength, the form. I'm going to go over what this means if you don't know already. This is the route, and this is how often they're taking it a day. Okay. So when we look at this prescription, we know that we need to have the doctor's information, the patient's information, right? The date that it was written, obviously the medication, the SIG, which is right here, the amount of tablets the doctor ordered, and doctor's signature. So on this, and there's one thing that is missing, and you'll see it over here. There are no refills mentioned. Typically, if there are 0, they'll have a 0 with a line through it. That would be a phone call clarification. And you, since this is not a controlled medication, you would be able to, as a tech, call for that clarification. Okay. So on this case, we're just going to go through this first one. You're going to have a freebie. It is hydrochlorothiazide, 25 milligram tablets. This signal is 1. Now we know this is a tablet, so it's 1 tablet by mouth daily. And that's what you're going to do for each one of these. And sometimes they're not going to say if it's a tablet or the route. And you're going to have to figure out, okay, so I think we have in our, and I'm just checking really quickly because I still have it at the side of my desk because I have not put away my stuff from last week. I know for a fact that it is, but I want to make sure that you're able to determine. Yeah. So in your inventory management lab that you did last week, there was a bunch of placebos in that zippy bag, and one of them is an X medication. So you know that when you look at that prescription bottle, it's going to say it's a tablet. So you're going to go, okay, he's ordering Furosemide 20 milligram furosemide tablets. How are you going to take a tablet? By mouth. So even though he hasn't written that, that's fine. Daily. And he has a refill of 2 times. So all that needs to be there, but there is something very important missing here. And somebody come off their mute and tell me. Because I can do without this. The date. What is missing that I cannot deal with?
How many tablets?
What's here?
Signature.
Signature. So yeah, those are the first two, and that's what you're gonna do for each one after that. There's a total, I believe, of 10 of these. So, any questions before I put you in your breakout rooms? Anyone have any questions? Concerns? Miss Huey, please go over something again. All right. So I'm going to put you in your breakout rooms. You do need to be on camera. You can send a message in that breakout room to me about what is your state that you live in and your student ID if you found it, or if you still need to find it, let me know. I do need it by tonight so that I can send it off to Dr. Obarge. And at 7:50, and take your time. There's no rush. You have until 8:50. Okay. So take your time. But at 7:50, I want you to step away, and I'm going to pop in each room again to let you know that we're coming close to it. You're going to pop into your 10-minute breather that you can go to the bathroom, get something to drink, whatever. But please remain on camera and work diligently on deciphering all of these. Okay. So I'm opening up the rooms now.
Hi, Patricia. How are you? Hello? Patricia, are you there? Can you hear me? Hello? Hey, how you doing? I can't hear you for some reason. I don't know if it's me or you.
There we go. Now can you hear me?
Yes, I can hear you.
Okay. Sorry, I was on double mute.
That's okay.
I found the assignment, and
Okay.
Talisha confirmed that it was the correct assignment.
Okay.
And the process of getting their student IDs and everything in the state that they live in.
Okay. All right. So are they in like break rooms right now?
Yeah, they are, but they're on their 10-minute break.
Okay. All right. Um, I just want to make sure that their attendance is being recorded if they are put in break rooms.
Oh,
Is
okay.
this the first time you put them in a break room or?
Yeah.
Okay. Yeah, I would have to check in case there's any issue with the assignments. I would have to rectify that, but
Okay.
we'll see how it goes.
All right.
Usually we do a 30-day observation.
Mm-hmm.
It's not 30 days yet, but it would be in week 5. So
Okay.
expect me to pop in your class anytime week 5.
All right.
Yeah, and I also wanted to introduce myself to the students, but if they're in the break room, that's fine. I'll do that next tomorrow. I mean next week.
Okay,
You do
sounds
it weekly, right?
yes, we do weekly class.
Okay. All right. So I'll do that next week then.
All
Okay.
right. Sounds
All
good.
right. You need anything from me?
Nope, that's it. Thank you.
Thank you. Take care. Bye-bye.
Bye. I was trying to figure out why you were in this room, and I'm now figured it out. Okay. All right, I'm having everybody return to the main room and to see how much more time that might be needed. Are you going to need some extra time? All right, so everybody is back in the main room now. I do know that a couple of you do need a little extra time, but what about the other two? I also wanted to let you guys all know that I did find your student IDs. The way that you would find that is going into the Canvas like you would normally go for class. If you scroll down, you'll see a tab that says People. You click on that, and then you're going to see your SIS ID, and that is what we're using. And that is what I grabbed. That is a student ID for the system. So you guys are all good on that. I do have all your states. I have that form filled out and scheduled to be sent out after class.
Thank you.
Oh, not a problem. It's frustrating when you can't find something and it takes me a moment. I had to Google it.
Could you do me one more favor? I
Sure.
don't know where it went, but the PDF disappeared on me.
Oh my, you, Anna.
I'm sorry. I should have just said I'm almost done though. I'm on prescription number 4.
Okay, but you
I've
got
got
all
to
that.
go through it and see all the stuff that was wrong with them.
Okay. Yeah.
So I will have it done probably within the next probably.
Not a problem. Not a problem.
Okay.
I'm going to go right here. If you go in your chat that is just between you and I, you should see that document.
I did, but it's like it disappeared on me.
It disappeared on you. Of course it did. All right, hold on. So let me find the chat button here. We're going to come back here. File.
And what it was is my microphone was down, it was off, and I was trying to answer you. So when I took it off, it went back to you, and I lost it.
Oh, okay. So there you go.
thing. But I
Do you see?
apologize.
Yeah, not a problem. Do you see the
Thank you.
direct message? Okay.
Yes, and then I'm almost done too with this, so I won't be much longer, and I appreciate it.
Oh, not a problem. You have until like 9 o'clock, like I said. That's for anybody that needs to work on it.
Thank you.
I just brought you guys all back here. Just to give you a heads up as well, Dr. Boise is going to be popping in next week. He wants to introduce himself to you guys. He's the program chair of the pharmacy technician program. And then he'll probably also pop in on week 5, but that's not for to see you guys. It's to observe me. So I'll be a ball of nerves.
What's he doing?
Right.
And one of the helpful hints that I have found as I worked in pharmacy and so forth is making a note of the SIG codes as I learned them. So then I could put them on flashcards with the meaning of them on the opposite side. And that was just easier for me to then study. right. I need to step away for just a second, but the headset will still be on. I can hear you if you ask a question. All right, I am back. I will be back on camera in just a second. Here. I do appreciate your patience with the breakout rooms and the little confusion on certain little icons within those prescriptions, but it'll get easier as you use them. And at some point this week, I'll also send you a document that I have for the SIG codes of the common abbreviations, which I know you're probably thinking would have been easier then if you would have given it to me prior. I have to know where you're at. I know. All right. I do know that Martha's going to finish up the assignment later when she's back with her laptop. Jasmine, how are you doing? Okay. Are you done?
Yes, with
All
the
right.
in class, right?
Yes.
Yes.
Yeah. Yeah. Okay. So that's perfect. You'll be able to then, if you wanted to work on maybe a response or a discussion post, you could, just for another 8 minutes, because we have 8 more minutes. Or you can just sit there. That's fine too. Um, did you submit it?
Yes, ma'am.
Okay, because I'm not seeing, maybe I have to exit it and then close, go out of it. I just always double check because I don't trust technology completely. And I feel like I'm chasing my tail half the time. Being greater. Let me check the grades to see if it's just showing there or not. Okay. It's not. So I'm just going to quickly here share my screen. All right, you are coming to this where the modules are, and you went into prescription checks proctored in class assignment.
Oh.
Yeah. Because I'm not saying it. Then you're going to, obviously, this is what you're going to see. This is for everybody. So you're going to choose whatever. If it's a text, just going to hit the text button so you get that. If you have a document that you did it on like a Word document, you can upload that. But I don't think anyone of you did a video.
About the prescription things we just did in the break
Text.
rooms.
Yeah.
Oh.
Thank you.
Gotcha.
Yeah, nope, I'm just making, because I'm not saying it, and I'm like going, oh, no, no, no. I trust that you did it, but I need to see it. So I'll leave it that up there for everybody.
I finished mine too.
Okay, so you did go to the modules to this proctored in
Yes.
classes. Okay, and all right, perfect. And that was who
And
was
I
that?
just wrote it down in text, all of them that but I seen wrong with them.
Okay, so that was Anna. Okay, perfect. All right. As soon as you have it
I'm
submitted,
sorry.
as soon as you have it submitted, and I have confirmed that I see it. So hold on a second. Just because we just had that disconnect for a second there. I want to make sure. And I have to leave the student view here. Is it? Oh, it is sharing that. Stop share. All right, Anna, you're good to go.
Thank you.
You're welcome. Have a good night.
You too.
Mhm. And I'm just waiting to see the little grading box up on you. And if you still need time, that's fine.
With the little symbol again, what did you say it was?
Hour.
Hour. Okay.
Yeah, that's something that's not commonly seen. I mean, it will be on the prescription, but it's not commonly like reviewed. So that I don't have a problem with. The little circle that looks like a degree, Andrea, is hour. And Martha, you're good to go as well.
Okay. Say
Just
that
make sure.
again.
I said you're good to go. Just make sure you get it in by that time, okay?
Okay, I will.
Thank you.
Thank
Have a
you.
good night.
You have a good night.
I submitted it.
All right, perfect. Then you are free to go and have a great night.
Good night.
Night.
Trying to get it submitted. I'm trying to find out where. Huh.
Oh, what's the
I
problem?
saved it as a PDF, but then it in Word, and now I got trying to get up.
All right, so once you go in that text box, you are going to see, you should have a file. Nope. So what you're going to do is click that upload button, and you're going to drag that file to that box, or you can look for it. Let me show you. Right here. So you see here how it has that text box, but then it has upload. You click here, it's going to let you choose a file. Does that help?
I got it.
Oh, perfect. And is it submitted?
Yep.
You're
Oh.
good to go then. You have a great night.
You too.
Bye-bye. I am still not seeing it. Shoot, and she's gone.